Hello, everybody. Thank you for watching, listening from whenever, wherever you may be doing so. This is the one and only Osprey Observer TV. And don't forget that by liking, subscribing, following this podcast and Osprey Observer, you're also supporting our local entrepreneurs and local leaders that make this community the exceptional place to live that it is. And today's no different. We have somebody who has crisscrossed the entire state of Florida, garnering an amazing education, only to bring it right back here to our community. And we're so grateful to have him, and as a dentist, no less. And he's one of these names that's just growing in popularity in our community, and that's Dr. Casey Lynn. Here's Marie with the interview.
Welcome back to My Osprey TV. And today we have a great interview. I'm really excited about this one. This is actually a local dentist that I physically met. We actually did a field trip to his office, and I have never seen anyone with more degrees on the wall, and all Florida based. So we can really stay with the hometown team here with Dr. Casey Lynn, who is the dentist at SmileLynn Dentistry, SmileLynn Pediatric Dentistry in Apollo Beach. So thank you for joining us this afternoon, Dr. Lynn. I know you just finished seeing patients today, and we're really excited to have you here on the podcast.
Thanks for having me. No, I'm happy to be here. It worked out.
And when I toured your office, first of all, very welcoming location, warm, really friendly staff at the front desk. I know you chose them on purpose, but I know your parents and your family is very proud of your pedigree. So let's just talk about all your different degrees and all the Florida schools you graduated from for just a second.
Yeah, all good. Yes, I was lucky enough to do all of my educational training in the state of Florida. Had a couple different times where I thought I was leaving the state, but then ended up getting into programs where I wanted to be. So I'm originally from Brandon, Florida. So grew up here, born at Brandon Regional Hospital, wanted to come back here after that and spend time with the family and stuff, but went off to Florida State for my undergrad. After undergraduate degree, came back to the Tampa area and actually did a medical master's at the University of South Florida, where I was kind of debating medicine versus dentistry, and did a master's there to kind of delineate, and then decided wholeheartedly on dentistry after that. Went to Nova Southeastern University down in South Florida, right out of Fort Lauderdale, for my dental degree. And then after that, decided I wanted to specialize and stay in school, and did 2 more years with the University of Florida at their pediatric residency. So I've been around the state, seen a lot of schools. I know how the ins and outs. If you ever have questions about it, let me know. I can give you some personal insight, but it was a really good journey, and I'm just happy to be in the Apollo community and kind of taking care of business and helping a lot of patients and families in the area.
Absolutely amazing. I love it. The only one you missed is UCF, really, that I think is on the map. And I'm just partial to that school because I have 2 children who go there. However, I think you got them covered because that's the new up and coming school. It wasn't really as big when you were going, but I think you did great. And I really think our young people have a great opportunity in the state of Florida with 14 state universities and colleges to choose from.
Absolutely.
There's great opportunity here. And I love that you grew up in the Brandon area, went off to school for that many years, and then came back home to build your practice. So describe SmileLynn Pediatric Dentistry to somebody who's never come into your office before.
Yeah, so SmileLynn's my baby. Obviously, when I got a residency, started it and built it from the ground up. We're 6 years in so far. In my opinion, like when we're talking about pediatric dentistry, my whole goal was doing pediatric dentistry differently, because a lot of pediatric dentistry is very high volume based, very fast paced, kind of get you in, get you out. That's what pediatrics is usually set up as, whether you're in the medical side or dental side. My goal was to make it more of a traditional dental home, not a clinic, not an office. Like, we're a dental home for people, and we want to be there from, first teeth till graduation from high school, and being that resource to, one, educate first and foremost, to prevent cavities and major issues with teeth, to keep the dentist like the easy, fun spot as comparison to the pediatrician. Sometimes we go there and it's not so fun.
And give you the shots.
Yeah, you gotta do what you gotta do. My goal is to never really do real dentistry. And that's my goal every day, is to educate, keep cavities away, practice a lot of minimally invasive techniques, and make my patients go from a nervous little 1-year-old to by 3, they're hopping in the chair knowing they're just getting high fives and balloons and prizes afterwards. And then helping them grow and transition through those baby teeth into permanent teeth, and then setting them up for success lifelong, so that when they do go off to college, they have really good oral hygiene and good structure around that from a dietary side of things. And then the general dentist won't have anything to do either. I'm trying to change the way dentistry was, because when I was in school, I had so many adult patients that I worked with that avoided the dentist for 25, 30 years. And it all came down to a traumatic event at the pediatric dentist when they were 4, 5, 6 years old and having to do some tough dental work. So my goal is try to prevent. And if we can't prevent, we treat in a manner that actually is beneficial psychologically to the kid. So we're not forcing things on kids. We're walking them through procedures if they can do it. And if not, we have other tools as pediatric specialists to make sure it happens well.
Awesome. And I have 3 boys, and we've always done the full range of dentistry all the way from since they were infants. And people say they don't even have teeth yet. Why are you going to the dentist? Well, just to remove that fear.
Exactly.
Somebody's just going to rub your gums a little bit, and again, give you a little prize, and I never want it to be a scary place. And my kids are fine. They walk in there, wide open, no problem at all.
Yep,
and
that's the goal.
It doesn't have to be a scary place. I had braces when I was a kid, so I am very diligent about going for my cleanings every 6 months, because I was like, I worked for these teeth. I already put the work in.
Take care of that smile. Yeah.
And they told me when I was 13, we don't want to see you in 3 years because you didn't take care of your teeth or didn't wear your night retainers or whatever. And so to this day, I still have my retainers that I wear at night.
Good for you.
Now the top one's more of a night guard, so I don't grind as much. 3 boys later, I tend to grind a lot.
Understandable there.
What's the best advice you could give our young people these days, if you could just give them one tip for dental hygiene?
If I could give every parent one tip, it's know that crunchy snacks like goldfish cause cavities. Like, if you understand that, you're going to be able to prevent a lot of disease. But really, the biggest tip I always say is, like, get to a board certified pediatric dentist early in your kid's dental kind of journey, because they're going to be able to educate you on those topics and give you the tools you need from a brushing and flossing side of things. But also the dietary aspect in America is, in my opinion, the biggest driver of cavities. And it's usually not candies, because we're conscious of that. Right. It's those crunchies that turn into the same acid that those candies turn into. And knowing how to eat those the right time of day. I'm not saying get rid of them completely, but it's understanding that if you're chomping on those all day, you're going to get cavities. That's one of my.
Oh my goodness. Okay.
Yeah.
You're right. I never would have thought goldfish as a cavity inducing snack. I'm thinking more of those, chewy, hard candies that kind of make your teeth stick together.
And those do it too, but it's more common sense with those.
Because you're thinking, oh, that's just a goldfish. It's a salty snack. It really shouldn't be a problem. But yet it really is a problem. Well, there's another feature of your business that I want to touch on as well, because I think it's something that not every pediatric dentist in our community offers. And I knew you have a tongue tie clinic as well within your practice. Can you tell us a little bit about that?
Yeah, so the tongue tie center really became like a labor of love, in a sense. Like, I got learning about tongue ties after residency. It wasn't something that was even taught in dental school or residency exclusively. So I do a lot of continuing education work on my own. I ended up going to a CE course as a resident to kind of just go for some lectures. And a guy was talking about tongue ties and how they correlate to feeding issues with infants and adolescents and speech issues with adolescents. And I got curious in it, and I started my journey after that, taking a lot more like specific continuing education courses, working with people who had done tongue ties before or ran that kind of office. And now, like, I help kids every single day. A lot of infants on the breastfeeding, bottle feeding front. Some kiddos will have extra struggles that aren't just pertain to like the early learning curve. And it's due to physical restrictions of movements of the tissues in the mouth. So, your tongue's a group of muscles. If that tongue can't push in the right spots, it can't push milk out of a breast or bottle. It can't swallow correctly. We're going to have a lot of kind of issues related to it, whether it's mother discomfort, a lot of gassy issues, a lot of colicky issues, a lot of spit up issues, or just inefficient kind of feedings, failure to thrive, and those kind of things are a piece of the puzzle at the young age. And then we help a lot of older kids who maybe got missed on some of those breast bottle feeding fronts on a lot of speech and feeding early on in life, and getting those tissues to the correct spot so we can move boluses of food around in the mouth with our tongue and not worry about choking on them, so we can enunciate correctly with our tongue position as we're talking. And a lot of kids struggle with that without ties. So we work really hand in hand with a lot of therapists in the area to delineate, is this a kind of coordination issue versus a true tie issue? And then, the tongue tie side of things is different at different time points for my patients. But it's my favorite thing to do because I get to really help these kids make that big step up in growth and development. And especially the little babies who come in at 4, 5, 6 pounds, and then I see them in 3 weeks and they've gained a pound, in those 2 to 3 weeks, because they can efficiently feed after those releases. So for me, it's my favorite part of the office. I still love taking care of teeth in my little patients, but it's just an adjunct to what we do. And it's a piece of our growth,
Well, I didn't realize quite how common it was, a tongue tie issue, until one of our staff members that we assigned to do a profile, and you said, well, I'm actually a patient, with my child. I mean, That was complete chance. That was serendipity, because we have about 14 freelance writers, and that just happened to be the one we assigned. So I started to learn a little bit more about it. So I know you are an expert in that area, and very, very good services you're bringing to our community, to the children out there. So thank you so much, Dr. Lynn. Thank you for providing such passion and eagerness to serve in our community with the pediatric dental practice. And congratulations on 6 years in business. I know you've got some parties and some celebrations going on, and you're in the area of our community that's in a high growth area. And so I think you're just right where you need to be. Apollo Beach is fortunate to have you. So thank you for being our guest today. Tell people how they can get a hold of SmileLynn Pediatric Dentistry.
Absolutely. Thanks so much for having me. It's a pleasure to be a part of this community. I love this area and the families around. Easiest way to contact us, whether it's the tongue tie side or the tooth side, is our website, smilelynndental.com, or call us at 813-591-3052. But we have a ton of resources on the website that can direct you to our office and or tongue tie center. And we'd love to help you. If you have any needs, call us. We'll help you out.
Thanks so much for being with us, and we'll talk to you again. Have a great day.
Thank you so much.